When treating severe psychological conditions, clinical protocols have traditionally operated under a strict hierarchy of caution. For decades, a deeply ingrained rule in mental health care dictated that if a patient suffered from a severe psychotic disorder, clinicians should never actively touch or uncover deep trauma memories. The fear was that direct exposure work would overwhelm the individual, spike their anxiety, and catastrophically worsen symptoms like paranoia, mania, or multisensory hallucinations. But according to a groundbreaking clinical neuroscience report featured by Technology Networks, a landmark study is completely shattering that old clinical playbook, proving that ignoring trauma doesn't protect a patient, it blocks their path to true recovery. The report details the results of the STAR trial, the study of trauma and recovery, led by researchers at King's College London and published in the Lancet Psychiatry. This massive multi-site randomized controlled trial evaluated an integrated 9-month treatment protocol called Trauma-Focused Cognitive Behavioral Therapy for Psychosis, or TF-CBTp. Historically, individuals navigating both psychosis and PTSD have been systematically excluded from trauma trials due to safety concerns. However, the STAR trial completely turned this dynamic on its head. The study revealed that working with trauma memories directly is not only entirely safe, but it also resulted in 50% of the treatment group completely clearing their clinical PTSD criteria. For the recovered life community, this breakthrough challenges the very essence of how we look at deep-seated emotional pain and psychiatric conditions. PTSD prevalence is up to 5 times higher in people experiencing psychosis compared to the general public, with their unaddressed past traumas actively shaping the frightening content of their delusions or voices. By integrating standard CBT tools with flexible, individualized trauma memory processing, patients were finally given the vocabulary to safely make sense of the experiences they had carried for years. Remarkably, the trial recorded a tiny disengagement rate of just 6.5%, completely disproving the myth that complex patients can't tolerate deep emotional work. Ultimately, this psychological milestone moves the entire recovery landscape from passive symptom management to authentic, comprehensive healing. Facing our deepest traumas isn't about rushing the story or forcing distress. It is about building a secure foundation of trust, engagement, and emotional regulation. When we stop treating the symptoms of the mind as isolated, fragile problems, and instead address the integrated whole of human experience, we open the floodgates to genuine, sustainable freedom. This monumental neuroscience report was originally detailed by Technology Networks, and you can explore the complete clinical trial notes and training guides via the links in our show notes.